Movember means an awful lot to me. When I went through the cancer, Movember didn't exist. The support network was very limited indeed in terms of both physical and mental support as you were going through such a life-threatening disease. When it came over to the UK, having started in Australia, it was brilliant to see that they were gaining such momentum so quickly. That element of support is so beneficial now. This is why we have to support it. And this is why I'm talking, because when I went through the experience and was diagnosed with the prostate cancer, there wasn't anything like this support. The cancer tends to be diagnosed and treated between 65, 75-year-old men. I just turned 40. It's such an early diagnosis. I found my GP really helpful because they are dealing with men, our population of a certain age that are being diagnosed. It's very familiar to your GP as well. And I'm sure if you've already been diagnosed, you've appreciated the support you've had from your GP. Mental health is also, just as important when you're going through this process, because if you can't make even moderately rational decisions because of the pressure you feel, the emotional association with the word cancer even, that can have an impact, especially when you've been diagnosed with it. Certainly from my experience, you can feel absolutely bewildered and confused by this whole process. Why me? All these different thoughts go through your head. And for some of us, it is almost too crushing, too overwhelming. And that's when the only way out seems to be ending it, finishing it, whatever glib expression we want to use, because we cannot experience what those people are experiencing themselves. Certainly, this is a male cancer, that if we have concerns about a relative or a very good friend of ours that has been diagnosed or is having concerns about this, then we also have an opportunity to encourage. We've got to lean into our network of friends, family, etc., but they in turn need to keep an eye on the person who's going through this process. We all respond to these different challenges in our own ways. It's much better, if you can, to seek out some specialist help, someone that is trained to listen, whether it be the Samaritans, again, coming back to Movember, because the mental health issues, as it suggests, trying to cope with it on your own, unfortunately, doesn't end up well. Mindfulness and meditation helped me enormously when I was going through this. I mean, by that stage, I've been practicing for over 20 years. And so the opportunity to recognize that I was bewildered and confused, and the mental health issues are just as important, because at some point in this process, you will have to make a decision, and that decision will impact your health as a man. Prostate cancer is a physical experience, and the mind is sending us these messages all the time that this is acute pain. Unless you have experienced something or something similar, then the empathy is incredibly challenging. If you go through that experience, you at least have to try and share with the person prepared to listen. Certainly, if you look at the way Movember's been running itself, there's a really conscientious approach to any form of investment in research. They've been very directed in how the PSA test, for example, as an effective method of identifying the antigen in the bloodstream that represents potentially the prostate cancer. If, again, it tends to be at that grandparent age, possibly granddad, uncles, or whatever, are going through this process at the moment, share some consideration. It is a very emotional term. Supporting some of that research has certainly been used very effectively. So that's two different ways. One which requires our emotional support and one that requires our financial support. I think that would be what I would suggest.